Hi everyone, my name is Michaela, for those of you who don't know me yet. Today I am going to talk about ethics and define that for you. So the definition of ethics, it's also known as moral philosophy, and it is the study of morality. Morality is beliefs concerning right and wrong, good and bad. There is an ethical landscape, so to say. This includes descriptive ethics, which is the scientific study of moral beliefs and practices. Normative ethics, which is the study of the principles, rules, or theories that guide our actions and our judgments. Metaethics is the study of the meaning and logical structure of moral beliefs. And applied ethics, which is the application of moral norms. Mainly has to do with professions like medicine, like being a doctor. Now the elements of ethics, there's four main elements. The first is the preeminence of reason, which involves or requires critical reasoning. There's the universal perspective. This is the idea that a moral statement must apply in all other situations that relate to it. The principle of impartiality. Sorry, I always say that wrong. This is that the welfare and interest of each person is given the same weight as all others. The dominance of moral norms, is when moral norms conflict with non-moral norms. Now there are rules of moral discourse. The first rule is moral positions need to be explained. The second is that claims need to be supported. And the third is the reasoning needs to be judged by common standards. Another important feature of ethics is moral theory. This is an explanation of what makes an action right or what makes something good. Wondering what makes an action right is to theorize. This makes moral theories unavoidable. When you try not to think about morality, but just rely on your default moral theory, this is called living by the lights of moral theory. When you reject moral theories completely, this is allowing you to actually have a moral theory. Now, what exactly does moral theory do? So it helps you assess principles and possibly make new ones, and it also helps shed some light on our moral judgments. Moral theories also cannot be used like a mathematical formula, and theories and moral judgments should fit together as closely as possible, and this is called reflective equilibrium. Now, there are two main types of moral theories. This is consequentialist. Sorry, I say this wrong too. This is what makes an action right based on its consequences. And then there's a non-consequentialist. This is what makes an action right in its nature or form. There's, and I'm going to say this wrong, utilitarianism. And this is the morally right action is the one that produces the most favorable balance of good versus evil for everyone. Then there's ethical egoism. And it's the same thing, but the right action for yourself or for oneself. There's act utilitarianism, which directly produces the greatest overall good for everyone considered. And rule utilitarianism is the right action that, if followed as a general rule, will produce the greatest overall good. When it comes to evaluating theories, some theories are better than others. You can't assess their worth, and no moral theory is perfect. There is certain criteria for moral theories. The first is consistency with moral judgment. The second is consistency, with moral experiences. And the third is usefulness in moral problem solving. Moral judgments are formed only after careful deliberation. Our moral experiences shows that we make moral judgments. We often give reasons for certain beliefs. Sometimes we are mistaken, and sometimes we do have moral disagreements. I believe ethics will help me in my future career, which I'm hoping to be a dental hygienist, by helping me be more understanding with patients. When patients are fearful of dental treatment, it usually comes from their prior experiences. So by understanding ethics, it allows me to be more patient with them, to be more considerate of what they've experienced in the past, and allow me to comfort them better. So I hope this helped you. Thank you.